So, welcome, Dr. Howard, to Raw and Cooked Vegan. And we're here today to interview Dr. Wes Howard, who's running a vegan practice in Charlottesville, Virginia. And I'm going to take him through his history, how he got into this, and we'll find out a little bit more perhaps about some of the reasons he got into this and some of the benefits he's seeing in applying these principles in his practice. So thank you for being here today.
Glad to be here.
Yeah. Can you tell us a little bit about how you were raised? Were your parents at all conscious of nutrition? Was it standard American diet?
It was probably for the most part standard American diet, although my mother was into Adele Davis.
Okay.
I don't know what, I'm not sure.
It rings a bell. I know that she was big. Was it 60s or 70s?
60s, yeah. 60s,
Okay.
70s. And I grew up drinking tiger's milk, for those of you out there that know what tiger's milk is. My mother used powdered milk, would put brewer's yeast in it, and so it would sit there, and I would drink it, and I got used to drinking it, and so she was health conscious at least. I'm not sure I knew all that, but she, we thought of ourselves as health conscious. Okay. I don't know if there was even organic back then or what.
Okay. But brewer's yeast is supposed to have a full complement of nutrients,
yeah,
isn't it?
Right.
Yeah,
well, B vitamins especially.
Okay.
We obviously ate meat. I remember grilling out steaks. I was the grill master for my family, and so I remember stuff like that. So probably you would think pretty standard, but on thinking ourselves in the direction of healthy.
Okay, and so it wasn't like Cheese Whiz and Twinkies
and
Captain
back there
Crunch.
wasn't as much junk food, and we probably. My mother probably thought that would not have been good, and so would keep us away from it. The traditional family, you ate at home, you ate home cooked meals, things like that.
Right,
so
that's good.
I'm old enough to have lived through that stage of.
So she did the best. She did the best she could.
Yeah. Right.
All right. Now, How early were you interested in medicine? Was this high school? Was it pre-med in college?
As long as I can remember, I had the plan of going into medicine. I have no idea how I came to that because there's nobody in my family. But I always saw myself as a doctor eventually, and that was my educational direction. Going through college, I was a pre-med major. I actually took 3 years between college and medical school to do some other things, but medicine was always, in fact, when I met Jackie, my wife, I had kind of taken a hiatus thinking I wasn't going to go to medical school, and then as we got serious with each other, all of a sudden, I think I'm going to medical school. Where did this come from? So, as I've gone through it, medical school and medicine, I like it very much in terms of a vocation. It fits me, my personality, things like that. So.
All right, fantastic. Now, before I do progress past that, how would you characterize your health growing up as a child and then into high school and college? Would you say your health was average?
Yeah, good.
Did you have the annual cold or flu? Did you have acne as a child?
I don't think I had acne. I was basically healthy. I had appendicitis. I'm not aware that I had any medical problems. I was lean and thin and athletic and healthy.
Okay.
I didn't really have. I've not been one that's been plagued with medical problems. So I have no miraculous cures.
All right.
To tell about. So.
All right. So you go through pre-med, and it sounds like you kind of it was challenging, but you just knew you felt like you were destined to do that. So okay, then you took a few years between your undergraduate work and your med school.
Yeah.
And then in med school you studied as an internist?
No, well, I was living in New Jersey, but went to college in Ohio and went to Ohio State Medical School.
Okay.
In Columbus, back from 74 to 77, 1974 to 77 is when I went to medical school. And it was 3 years. I did an independent study program, but basically when you go through medical school, everybody's doing the same thing. All MDs, which is what I ended up being, go through the same kind of training. The first year and a half is all in the classrooms, and we called it normal. First of all, you study normal man, then you study abnormal man. It's all the normal physiology, anatomy, stuff like that. Then you study diseases, and the second half of medical school is in the clinics, where you begin to actually get involved with taking care of patients. and you start at the lowest levels, a medical student, the shortest jacket,
Like
and
20 hours
no
a
nothing.
day.
But you have to get used to doing a physical exam and talking to patients, and you work as a team. So you work your way up, and then so you get some actually clinical experience. But the day you graduate from medical school, you know everything and you know nothing. You have an MD, you're supposed to know it all, but functionally you know very little. And there have been some places in the United States where the day you graduate from medical school, you can actually go in and become a GP and start practicing. I was always of the philosophy that the more education you got, the better. Better to be overeducated than undereducated. But the day I graduated, I got an MD, and my plan had been to go into internal medicine. And I'll explain internal medicine in a minute, but what I wanted to understand how things worked. And internal medicine, in a way, is kind of the center of medicine. Internal medicine is the discipline of being prepared to take care of adults, not pediatrics, not kids, not pregnant women, but internal medicine is the foundation of taking care of most adult medical problems. And on top of internal medicine, you can subspecialize into the heart, kidney, the digestive tract, lungs, things like that.
Right.
So you're 2 years of internal medicine residency makes you an internist to take care of adults and all kinds of things. And that's what I ended up doing at medical school. I ended up going to Portland, Oregon, to do my internship, and I actually did kind of a rotating internship in internal medicine, and then we ended up in Birmingham, Alabama, where I did actually 2 years of residency, internship and residency in internal medicine. And I actually was the chief medical resident in this institution I was in as a internal medicine, and then after that I taught internal medicine for 2 years.
Okay. All right.
So I got heavily into internal medicine, which I love.
All right, and you were with Jackie in Alabama.
Yeah, we were married.
Okay.
We married partway through medical school, and
okay. And I'll let the viewers know, we have Jackie's back here helping us with the camera, so occasionally we'll refer to her, but you won't be able to see her. But so one thing that you bring up that I'd like to hear your thoughts on, and I think it's part of this issue that, of course, in this discussion we're going to get into the plant-based diet and why that's useful. And one of the issues that interests me is the slowness with which this is being received by the public.
Right.
And I wonder if perhaps this has something to do with the way we culturally assign responsibility to physicians. So, you talk about, you go into med school and you're supposed to learn everything. You come out 4 years, you're supposed to know everything. And it's impossible. There's no way you could know everything.
Right.
Even with the 50 years of practice,
right.
you're always learning, right?
Right.
So, but at the same time, I think a physician needs to have a bit of an ego to get through this,
Right.
So it's kind of this dichotomy, because, you run into doctors who have such big egos that there's no light can come in from something
Right.
new.
That's true.
And I feel like we're facing this a lot with this plant-based regimen. So what are your thoughts on that?
Well, you said acceptance by the population, but the first thing is acceptance by the medical profession.
Mm-hmm.
Okay. And it's interesting in the history, if you look at the history of diseases and the history of medicine, you have the development of, for instance, way back when you had doctors, you had a lot of, many people were poor, many people may have been malnourished, not in the Western cultures, but other ones. And so you had the diseases of deprivation, okay? And as we come into the modern era, we begin to have more affluence, more food available, other things. And so Western medicine grows up into past the period where doctors did the best they could to a point at which we begin to get a set of diseases that becomes central to our life in the West. For instance, high blood pressure, diabetes, heart disease, things like that. Things that you don't find in underdeveloped, malnourished people. Okay, that's not the West, but I'm talking about, and we'll talk about having spent 2 years in Africa, I got to know that.
Right.
But, so, the medical profession is geared on taking care of the thing that's on their front burner, okay?
Yeah.
It's the big diseases of our culture. Now, You get things like broken bones, orthopedics, you get things like surgery, appendicitis, things like that. But you have a whole set of chronic diseases. The number one killer in the United States right now is heart disease, ischemic heart disease. If you say heart disease, you got a lot of different varieties there, but atherosclerotic or ischemic heart disease is heart disease caused by narrowing of the arteries, the blood supply to the heart, which causes heart attacks, which is the number one killer in our culture. Okay, so obviously the thing that's the number one killer, you think these medical schools got to teach you that. Okay, then they got to teach you things like how to take care of digestion, your kidneys, your lungs, your skin, all those things. So all the MDs have to have a basic training in that. One of the arguments is that doctors get very little training in nutrition. Well, I'm one that thinks we should get more, but you could never provide enough, because what we have come to see is that nutrition is one of the most important elements in the medical condition of our culture, but you could not put so much emphasis on that you prevent that, and then you haven't learned your basic diseases. Because through medical school comes your super specialist, your infectious disease specialist, who is an expert on antibiotics and bugs and all that stuff. How much do they need to know about nutrition? Probably some. So there's a balance here, and I think it needs to be a realistic balance of how much nutrition you need, because nutrition in medical school is a disease state like scurvy, which vitamin C cures. Okay, they'll teach you that, but they're not going to teach you much beyond that. And that's, I think it could do more, but I don't think you'll ever get to the point where what I do, is really taught that much. I think there needs to be more awareness that this plays an important part. And I think what you get in the medical culture is kind of almost blinders to, this is our medical problem. I mean, take for instance, ischemic heart disease. Most people that have heart attacks get the idea that it's the plumbing, it's the arteries, so you either get a bypass or a stent.
Right.
And then you get a cholesterol medicine, a statin for your cholesterol.
Right.
And then oftentimes the cardiologist will say, you'll be fine. What should I do about my diet? Oh, don't eat fried food. I've had people say that's what they were told. And so that's what they focus on, that's what they do. And they don't really tell them the most important part, that lifestyle or nutrition is the most important thing in the etiology and the curing of this disease.
And how common is it that someone who gets a stent is back 3 years later with another problem?
If you eat a standard American diet, what the studies show is 2/3 of those people will have a recurrent thing. Now, some people can have an episode and they can go the rest of their life and not have another one. But the statistics are that 2/3 of those people will recur in terms of coming back, either an angina or a heart attack. The bad symptom is sudden death. One of the most, some people who have silent atherosclerosis, their first symptom is they drop over dead. I mean, that's somewhere 40% of men, up to as many as 60% of women will drop dead. They never had one symptom, and that's their symptom of dead.
And that's very much like a stroke. A stroke can come on just
right.
I mean, you can get around a heart attack, but a stroke is a much different, it's a different ballgame altogether.
Well, stroke is the brain.
Right.
Same kind of etiology in the brain.
But I mean, in terms of the damage it does to one's body,
Well,
if you're
death is pretty bad damage.
Death
is like your whole being is dead.
Totally. Yeah.
So, I mean, that's the worst, and that's the disease. Many of those patients present with sudden death, so
What's the percentage of that sudden death? Is that
40% in men sometimes, up anywhere from 40 to 60%. That could be their first symptom, their first and only symptom.
And they die.
Now,
that's incredible.
So now, here's what happens is they get a large artery obstructed. That causes enough ischemia or lack of oxygen to the muscle that it goes into a state of developing an arrhythmia, and you get V-fib, which is the bottom of the heart, the ventricles are quivering, not pumping any blood. You'd have no blood flow at all. The person falls over, and if they're not shocked and resuscitated right there, and believe me, I've shocked and resuscitated people right there in the ER that have done this, they're dead within 3 to 4 minutes.
Wow.
So
okay,
that's unfortunate, but it happens.
All right.
very often.
So there's so much,
Anyway, let's go.
yeah, so many angles here.
Yeah.
But let me go back to your progression. So
Okay.
you get out of med school, you go down to Alabama,
Yeah.
and you begin working in the general tradition of medicine.
Yeah, internal medicine. But then the life change we made is we moved from Alabama to Charlottesville, where we've lived for 32 years. And during that time, I made a career decision that I wanted to get into. I'd got my board certified in internal medicine. I loved internal medicine, but for a number of reasons, we chose emergency medicine to do. So when we came up here in the Charlottesville area, I actually worked in a general hospital, the next town, Waynesboro, and I did emergency medicine. I actually got my boards in emergency medicine in '89 and did that for 5 years here. Then we as a family went to Kenya, where I worked in a large mission hospital. That was a wild experience. For 2 years, was kind of planning on doing that the rest of my life, because African medicine is really interesting stuff.
And you just took your whole family over there.
And we all went over there.
That's incredible.
We loved it. My son's in the State Department now because he got bit by the African bug.
Right.
But anyway, it was totally different because you have a whole different set of pathologies. 2 years I never saw a heart attack. There's a whole different set of diseases there. But it gave me a broad perspective of pathologies I'd studied about in medical school but never seen. I mean, and then I had elephant maulings and elephant crushings and lion maulings and things like that. So all kinds of diseases you never see here.
Wow.
But it was very interesting. It gave me a breadth of experience in medicine I would have never had otherwise. I came back, and since then, 25 years now, I've done emergency medicine. And now I'm doing lifestyle medicine, which we'll get to eventually.
Right. Okay.
In your progression.
Yeah. Now, does emergency medicine mean that you are assigned to the emergency room and you're taking whatever comes in? It could be gunshot wounds, knife.
Emergency medicine is a specialty developed in the 70s, and I was trained by a bunch of really sharp emergency medicine doctors to be a skeptic and a scientist and all this stuff, evidence-based medicine. But basically, as an emergency medicine doctor, you man the emergency room and emergency department, and basically you have to be ready for anything and everything up front. So in almost 30 years of emergency medicine, I don't know how many hundreds of thousands of patients I've seen, and after that you've seen almost everything. But you have to be ready for anything and everything, even though you may take them for a short period of time and hand them off. But it's basically diagnosis and stabilization. And I've worked anywhere from, small community hospitals to the University of Virginia. I was a part-time attending for a while. So there you have a hospital full of consultants. You just call them down, they come and take care of people. So it's been I love emergency medicine, except you have to work nights. That's the downside of it. But it's interesting because emergency medicine is a narrow slice of the pie. You got to be ready for anything and everything, but you only have to be ready for a short time. So, but I loved it, but it didn't lead me into lifestyle medicine. But it gave me a safe position to watch what happens with people as they become chronic patients. I ended up in a small community hospital here, where we knew the community, and I would take care of many of the same patients. For instance, type 2 diabetics, who over the years you see them beginning to fall apart because of their disease, and that led me more and more to think, are we doing the best we can with these people?
Right. Yeah. Now, something that you make me think of, and over the years, I've developed probably an overly skeptical attitude towards what I would say is conventional medicine, and my standard line would be, well, if you get in a car accident or something of that nature, then doctors are great, which is the work you were doing.
You need the emergency medicine doctor.
That's great. But for much else that you need help with, it's simply what you're putting in your mouth, and that's what you need to change. And I think you somewhat explained earlier perhaps why nutrition is not so much emphasized within medicine. But as you say, it must have been frustrating when you see these cases. And one thing I'd like to ask you, before you had this aha moment personally for your own diet, I'm sure you must have over the years seen some literature, an occasional study, or perhaps another medical professional who talked about diet. And what was it in you that, was it just you have to be ripe and it has to be the right time? Did you kind of poo-poo it and say this is, this guy's
No.
off the rocker?
I think going to Africa was important because I had trained in America. I went to Africa. I began seeing that some of the diseases were the same, but some of them didn't exist. Okay, so a cross-cultural experience where you go to a different setting and you begin to recognize. I mean, not seeing a heart attack for 2 years didn't surprise me, but it was a common daily thing in the United States. So you begin to get a cross-cultural perspective where you ask yourself, why does it not exist here? And it's easy to say it's genes, okay, and that's the common,
The default.
okay,
The popular
but
default, yeah.
it wasn't just the genes, other things, but it was having that experience and then coming back and then beginning to ask myself the question. My wife and I also work with a cross-cultural organization that works with indigenous people coming to the United States, and I began to see that these people are getting Western diseases too, type 2 diabetes. Some of them have ischemic heart disease. We had a friend of ours from India that came over here, had a heart attack. This is before, about 6 years ago, when my wife was much more into health than I was. It wasn't that I was against it, but she gave him a book on reversing heart disease. He went back and actually did it. And it was one of those
Was that
things.
Esselstyn?
Yeah, no, it wasn't Esselstyn. It was
Oh.
somebody that we might not even fully approve of. But this guy turned his heart disease around. But the conversion experience came. We had always been healthy. Okay, we had followed functional medicine, Jeff Bland, and people like that. And I had gone to lectures. We had really listened a lot to it. And I said, okay. I mean, here's the standard thing. Many people in this culture think that they're healthy, and I was basically healthy. We were healthy. We didn't have a lot of medical problems. And they also think that they eat a good diet. And we thought, we're eating organic chicken, and we're not eating a lot of junk.
Right.
We like cheese. Jackie used to make quiche Lorraine when we were first married,
Yeah.
Lots of bacon, lots of cheese. Oh,
Yeah.
it was great.
Yeah.
We loved it.
Yeah,
Okay?
of course.
So, it wasn't that we were, we thought of ourselves as doing the best we could, but here's what happened. I think I began to say, isn't there something we can do for these chronic disease patients? And I didn't think of the solution, but I was more focused as an emergency medicine doctor. I wasn't responsible to take care of them, but I was responsible for doing the acute thing. And
Right.
so, but I began to say in this little community, take a diabetic, okay? Somebody gets type 2 diabetes, okay? And they're a good patient. They're following their blood sugars. They're not eating carbohydrates. They're doing everything their doctor tells them. And pretty soon, their eyes start going. They get microhemorrhages in the back of their eyes. Their kidneys start going. Pretty soon, their nerves are affected. They get either numbness or burning in their legs. And pretty soon, they're getting amputations. And, you see these people, and your heart goes out to them, and you think, is this the best we could do? Okay, so what happened to us is we have a Whole Foods here, and there was an advertisement for Joel Furman's conference. He's in New Jersey, not far from here. So I don't know if Jackie brought it home to me or I saw it, and I said, this guy's got a weekend where he has you come to a hotel. He feeds you, he lectures you. So I said, let's go do it for 3 days. So we went, and Joel Furman is very much on the research of nutrition and medicine, and has been practicing for like 30 years.
Yeah.
And I listened to this guy, and I said, there's a lot of science behind what this guy's talking about. I had heard similar things, but it had never come together and made so much sense for me. But it was like an aha moment to where suddenly, what he's talking about is chronic diseases. I had gotten used to the paradigm of Western medicine is very powerful. It's got lots of things it does, and the thing that Western medicine does well is diagnosis. It's phenomenally good at diagnosis, so good now that we have overdiagnosis.
Okay, so welcome back. And if you could, Dr. Howard, just briefly define for us functional medicine. So that kind of became your modus operandi for diet and your approach to health for a few years.
We had dabbled in functional medicine, which is a step forward, but it basically it looks more at disease process, but it tended to use medical foods, which were like a fancy supplement. But when I was at Joel Furman, the thing that really struck me, this was really, see, I had been trained in traditional medicine, and traditional medicine takes a disease like hypertension, like ischemic heart disease, like type 2 diabetes, and basically, without understanding it, you would end up saying to the patient, you can have this the rest of your life. This is a lifelong condition. Hypertension. Everybody knows hypertension comes because you get old. Okay.
Well, right.
So here I go to hear Joel Furman. He's giving you the nutritional science, but what he's telling me is these things that I thought were lifelong, he can reverse them in relatively short periods of time. Hypertension, ischemic heart disease, type 2 diabetes. Wait a minute. And he had people there. He had an example of a guy that had weighed like 400 pounds and he was down to 200, but you know he had lost his weight, he's lost his diabetes. So all of a sudden, these people or these diseases that I've seen in people in the emergency department in this little community, over time, getting worse, doing everything they were told to do, eating well. Some of them didn't care. They, you kind of expect that with them, but the people that were doing the best they could were still having the bad outcomes. And so all of a sudden I'm in a setting where this guy's giving me the nutritional science. He's saying these things are not chronic, they can be turned around with nutrition or what's called lifestyle medicine. And so it was like, really? And so all of a sudden a light turned on, and here's the conversion that happened to me from going to believing and authentically believing and not having a real doubt that Western medicine is very powerful. What they produce, their drugs, procedures, surgeries, all this stuff was really powerful. It was. All of a sudden there's something more powerful than that, which is as simple as the choices you make with your lifestyle, of which Joel Furman focuses the most on what you eat. Because, let me just show you this. So lifestyle medicine is made up of 6 different parts: nutrition, exercise. This is tobacco and alcohol, and that's in the area of things that people abuse. I mean, back in the 50s, you had the tobacco culture where even your doctor smoked.
Right.
It
was healthy to smoke.
They say the average American back then smoked half a pack of cigarettes a day. Well, if that's the average, that means there are people smoking 2 or 3 packs a day. That was the time when there were advertisements on TV. Your doctor would say, if you have a sore throat, try a Lucky. I smoke Luckies, he smokes Salem, stuff like that. So that's the
right.
abuse of tobacco and alcohol, and then you have stress management, sleep, and healthy relationships. So basically, there are essential elements to lifestyle medicine. But here's the conversion. You come down with something like hypertension, ischemic heart disease, you've had a heart attack, or type 2 diabetics. All of a sudden I was introduced to the idea these are not lifelong terminal diseases. These are things that come, and this, back in the 1990s, doctors began to say, hey, wait a minute, this is not just your genes, although genes can contribute, okay, but genes can be modified by the environment you give them, which is largely what you eat. That's called epigenetics, okay. And so lifestyle medicine is the belief, and as we got used to these chronic diseases that kind of, like up to 80% of our medical problems are these chronic diseases, things such as dementia, things such as arthritis, whether it's rheumatoid arthritis, lupus, osteoarthritis, those are very much affected by lifestyle issues.
Let me have you reassert this just very clearly for the viewer. 80% of illnesses are primarily correctable through dietary change.
Now, let me just get something to.
I mean, we could include in that. There's heart disease.
Yeah.
There's diabetes.
Right.
There's, like you're saying, arthritis.
Let me just read you out of Michael Greger's book, How Not to Die, because he's got a index of all the different things. I mean, heart disease, lung disease. Now, lung disease, we think of lung
Cigarettes.
cancer or
Right.
COPD or chronic lung disease. Cigarettes were one of the main things as far as that goes. Brain disease, what you're thinking was dementia there.
Yeah, like a Louis.
Digestive cancers, colon cancer is very much a lifestyle thing. Infections, diabetes, high blood pressure, liver disease, alcohol leads to cirrhosis,
And
blood
just
cancers, kidney disease, breast cancer, Parkinson's disease is not as much lifestyle, but things like multiple sclerosis is very much a lifestyle disease.
Right.
So what I was introduced to is a completely different paradigm that did not focus so much on diagnosis. Diagnosis was still a very important part of it, but all of a sudden the whole array of therapeutic modalities, there's a different set of principles now, and I remember an experience that I had.
all right. Before you get into that, I think we're going to pick that up in the next segment.
Okay.
So, but we're gonna dive more into this because there's so much here. We'll check back for the next episode, but I want to thank Dr. Howard for joining us, and we look forward to talking with you more. And we're going to get into so many more facets of this. But thanks for joining us, and we'll be back.